Thank you for joining us today. My name is Caroline.
And I'm Cam.
And we would like to talk to you about blades of
Glory?
combat.
Fields of combat.
Fields of combat. Chapter 5.
Chapter 5.
Chapter 5 discusses how we have come to understand PTSD today and how our culture has developed an understanding of PTSD.
It's really been quite a journey over the years. Why don't you come with us and we'll show you how it's been.
And I'm Tanner, and I'm here to give you all a disclaimer. My group takes PTSD and this project extremely serious. However, we wanted to deliver this information in a fun and engaging way. Stop it, Gerard!
Hi. So our presentation starts with a discussion of the Civil War. During the Civil War, people who we would now describe as having PTSD were thought to be insane or extreme cowards. Symptoms included the inability to work, extreme violence towards family members and peers, and excessive drinking. This was dealt with by, for the most part, just completely ignoring it, or individual commanders would do what they saw fit, which in lots of cases was just telling the soldier to go back to the battlefield, or in some cases, execution.
During World War I, there was no standard policy for dealing with people with PTSD, or what we now know as PTSD. 3 of the common responses would be they could get a pension if it was caused by enemy action, but more often they were told to pull themselves together and they were pushed back onto the front lines. Or, quite unfortunately, Great Britain executed 307 of their own soldiers for what they called cowardice, and there was no pardon issued until 2006.
How's it going, folks? So during World War I, the British established this 3-echelon system where they used this echelon system to control and separate soldiers that had minor PTSD or shell shock at that time versus soldiers who had severe traumatic stress. And this system worked where they would have real close psychiatric help that was a vehicle drive away. So they kept that really close to the battlefield for the turnaround time for soldiers to get back on the front lines. Then they had a system, wow, where they had hospitals close to the battlefield, and then they had a system set up where hospitals in other countries where soldiers were sent. I hate you, Cam. And the third echelon system that they had established was hospitals in other countries that catered to soldiers that were showing signs of severe shell-shocked or psychiatric issues from being on the front line. But post-World War I is where we made some serious advancements after doing in-depth psychiatric testing on soldiers from World War I. The U.S. spent just about $1 billion on psychiatric studies to help us understand the mindset of these soldiers that were coming back from war and how these loud bangs, bombs going off, people getting shot, long days, hours in the trenches, and how they would respond to these traumatic experiences.
After World War I and World War II is when we really started to realize that something was wrong and this was more than just cowardice or individual issues. In 1946, the National Mental Health Act funded research into the causes of psychiatric disorders, and that's when we started to have the first documented cases of traumatic neurosis, which we now know as PTSD, and also Valium became available to treat anxiety. By 1947, the VA began providing pensions for neuropsychiatric disabilities.
So after the Korean War is when we realized that PTSD was a normal reaction to challenging events such as combat. This meant that it was no longer seen as a random event or a flawed characteristic. It was seen as being expected and predictable. So with this understanding, it was carried into the Vietnam War, which is defined as the conflict that redefined war trauma. And even though Vietnam is seen as a conflict that redefined war trauma, it's actually the war that had the least combat stress casualties. So that means in terms of people who were diagnosed with having psychiatric stress disorders, Vietnam initially had the lowest percentage. In World War II, it was about 101 per 1,000 troops that were diagnosed with psychiatric stress. In the Korean War, it was 37 per 1,000 troops, and in Vietnam, it was 12 per 1,000 troops. Vietnam is considered as redefining war trauma because when vets returned home to the United States, many of them succumbed to mental illness as well as extreme substance abuse and have some of the highest rates of suicide. This is due to the fact that many of the soldiers were drafted into the war, as well as the guerrilla tactics that were used while fighting. Additionally, when Vietnam vets returned home, there was a rejection of them because of the anti-war sentiment.
So in the late 1970s, revising members of the Diagnostic Statistical Manual of Mental Disorders, or DSM, were getting together to create the third edition of the manual. An anthropologist named Alan Young pushed for Vietnam syndrome to be included in the DSM, and he later convinced the committee to accept the diagnosis, and also that was when it was renamed post-traumatic stress disorder, or PTSD. And this is important because the DSM is what psychiatrists use to diagnose and prescribe in their treatment, and that definition is what psychiatrists actually use today.
From insanity and cowardice, to shell-shocked, to post-Vietnam syndrome, and finally to PTSD.
It's been quite a journey. Where will we go next? You decide.
PTSD is not something that's going to disappear overnight. It will continue to grow in different forms and expand over the years. However, as outdoor educators, it is our responsibility to help those with PTSD and other disabilities and give them a chance to recreate and grow and recover from their injuries. This is Alpha Company, and we are signing out here today.
See you next time.